Hi guys, welcome back to another episode of Personal Trainers Who Care. Today I'm joined by Andrew Holmes. So he's the founder of Sleep Efficiency. He works with people who struggle with sleep issues. He's a sleep technologist by trade. I'm super excited to have him on, especially because recovery and sleep is probably the most important thing in terms of advancing your training, advancing your fitness, your health. And I think so many people are focused on what they can do as opposed to what they can actually recover from. So we're sort of going to talk about sleep architecture, the importance of sleep, how to know you have sleep issues, and just go from there. But I'm going to let him introduce himself, talk about his background a little bit. Thank you so much for coming on.
Thanks for having me. Pleasure to be here.
Yeah.
So my name is Andrew Holmes. I'm a sleep technologist. The official designation is a registered polysomnographic technologist, RPSGT, which is a mouthful, so definitely easier to just say sleep tech. Just how there's ultrasound techs, X-ray techs, MRI technologists. I went to school specifically for sleep medicine technology. I started my career at the Queensway Carleton Hospital, located here in Ottawa, working straight overnights for about 13 or 14 years, doing diagnostic and therapeutic studies. The irony drips from the sleep lab walls because we're trying to promote and practice good sleep habits, yet we're doing overnights. And actually working overnights now and shift work has actually been listed as a carcinogen, a possible carcinogen by the World Health Organization. So, but I did sign up to do sleep, and that was kind of my starting point, straight overnights for 13, 14 years. I then won the competitive process of senior of the cardiopulmonary department, where I oversaw a team of about 50 or so. So the cardio department at the Queensway, we tested anything to do with the head, the heart, or the lungs. We kind of tested for there. And the sleep lab was part of that. So I ran the 9-bed sleep lab for about a decade. And in 2015, I founded Sleep Efficiency, not really knowing exactly what I was going to do with it, but we incorporated it as more of a consulting kind of company to start off with. And we've evolved it a lot more to now we're one of the leading providers of home-based sleep testing, where we're shipping our devices right across Canada. Mm-hmm. And I've done a bunch of things in between, from working with sports organizations, with the Ottawa Senators, the Toronto Argonauts, a lot of presentations to large groups, Department of National Defense, Ministry of Transportation. And I love doing these because it spreads awareness, and it's a massive piece of, we spend a third of our lives sleeping, and a lot of the time it's not given the attention that it deserves. So I'm excited, and thanks for bringing me in here today.
Yeah, for sure. There's so much coming out now about the importance of sleep and how most people, especially now, are not getting enough sleep, like 6 or fewer hours a night. I want to kick it off by saying, what makes sleep inefficient? Mm-hmm. Or efficient, whichever positive or negative way is more efficient to talk about.
Yeah. You could look at it from a variety. There's a lot of different things that impact your sleep, first of all. So it's not one thing that makes it efficient or inefficient. There are intrinsic factors that affect your sleep. That could be, different sleep disorders. There's over 100 different types of sleep disorders that have been kind of acknowledged now. It could be extrinsic factors, like you live in the downtown core and there's horns going off or alarms, or there's noise outside, or maybe you're sleeping beside your partner who has terrible sleep, and therefore that's impacting your sleep quality as well. Mm-hmm. So I wouldn't say that there's, one thing that, makes it good or makes it bad. It's a cumulative over, a variety of different factors and different situations. I guess we could start off by saying this, not giving yourself the sufficient amount of time we can talk about. So as per the American Academy of Sleep Medicine, which is like our governing body, the recommended amount of sleep is somewhere between 7 to 9 hours. That's what they're suggesting to be optimal for peak performance.
Not 6 to 8.
Not 6 to 8, 7 to 9. Now, we also have to be realistic. And everything I'm going to say here today is do the best you possibly can. We're not trying to preach, live your life. Life is meant to be lived. You've got to do what you got to do with requirements to family obligations. You want some downtime. So life is all about balance, but they will say, 7 to 9 hours to be in that situation where you're able to, operate at a peak level for your mental health, your physical health, your emotional health. Now, aside from, the timeline of getting those hours locked in, there's a lot of different sleep hygiene tactics, tips, and tricks that you could potentially implement. I've said this several times in the past, Quality sleep doesn't happen when you go to bed at night. It's all the things you do throughout the course of the daytime that are going to allow you to sleep well at night. If you have poor sleep, it's not just a sleeping problem. It's a problem that's there 24 hours a day. You're suffering from that poor quality sleep all day long.
Yep.
It can be a 24-hour problem, but it's generated when you go to bed at night, depending, again, on whether you're not getting enough or whether the sleep quality is impacted, your sleep stability. When we go to sleep at night, I can touch on this quickly. We pass through sleep cycles, which are about 90 minutes to maybe 110 minutes in duration, where we go from light stages of sleep to deep stages, and then we close it with a dream period, our REM sleep. Our light sleep is just kind of your first initial stage where you're kind of drifting in between sleep and consciousness and unconsciousness. Maybe 5 to 15 minutes is how long it should take for you to fall asleep in a perfect world, so to speak. People think that, I fell asleep in 1 minute or 2 minutes. I have no problem sleeping. Well, that tells me that you might actually be carrying a sleep debt. If you can fall asleep within a minute or so, that's not necessarily a good thing. So your first stage is just kind of your stage 1 and 2, which is light. Then we move into our deep sleep, otherwise known as our slow wave. And that is our deepest form of sleep. It's the most difficult to arouse from. It's when growth hormone is released, muscle and tissue regeneration take place, our blood pressure drops, our heart rate drops. It's like the physical restoration that happens. And that's usually the first half of the night, more so the first half. You do touch on all the different stages, but your deep sleep is that physical body repair. Once we finish our slow wave sleep, we move into our dream sleep, otherwise known as rapid eye movement. For phasic eye movements, your eyes flutter back and forth. That is responsible for your cognitive restoration. It's more your mental horsepower. Memory consolidation takes place. Things that we've learned, transferring them to a long-term file, encoding them, and then actually your ability to recall that information. That's all supported in your REM sleep. It's also responsible for your emotional regulation, how you deal with stress and anxiety. So all of these different stages occur on this 90-minute cycle or 100 minutes, depending on your age and sleep architecture, which you talked about. And if you're not hitting all of those different stages of sleep, that could be affecting your overall sleep quality and how efficient of a sleep you are. So I'll take a pause there.
And then also, oh my God, excuse me, guys. And then also sorry, let's backtrack. It's going to be a reflection of different parts of your cognition during the day, the sleep that you're getting. So if you're having memory issues, could that be a REM issue? Or is there a direct cause and effect there? Or can people get clues to which parts of their night they're suffering from? Or is it throughout the entire cycle, the whole 90 minutes you go through the deep sleep and then the rapid eye movement and then waking up again?
Yeah, you do hit on all of those stages. And, let's say in that 90-minute cycle, it should be broken down into percentages. But again, depending on how old you are, right? So let's say teenagers, for instance, they spend so much time in their deep sleep. I have 2 boys that are 17 and 15. One of them's 6'2" now. The other one's 5'11", 6 feet. And they walk out of the bedroom like, oh my God, you grew overnight. And you do, right? They sit in that deep, slow wave sleep where, there's the expression, you don't grow in the gym, you grow when you're sleeping at night. You build and recover then. So the slow wave sleep is predominantly that physical restoration that occupies the first part of the night, but the REM sleep kind of tends to happen more so towards the end of the night, the back half when you're doing that mental restoration. But again, on a percentage, you should be getting somewhere between 20-25% in your deep sleep and your slow wave sleep. And your REM sleep, I would say maybe about 18 to 22% should be of your REM sleep out of that 90-minute cycle. And then the other 40 to 50% are taken up by that stage 1 and stage 2. Okay. So if you're shortchanging yourself in those areas. And, you think, well, how would people know that, right? There are sleep trackers, and we can talk about that. But at Sleep Efficiency, we offer a home-based sleep test. And not only are we, ruling in or ruling out sleep disorder breathing, we're actually able to get the amount of REM sleep in minutes. We're able to get the amount of slow wave sleep in a percentage in minutes. So we can actually see those sleep cycles that are occurring. And therefore, like you said, your memory might be affected if you're not getting sufficient REM sleep, your overall physical fitness levels. Maybe you're not seeing the gains that you want to because you're not hitting as much slow wave sleep as you potentially could. Yeah. And that all comes out in the diagnostic sleep test, which is, again, one of the things we offer. It's pretty amazing that, once upon a time you'd have to go to a hospital where you'd have 1,000 wires attached to you. And I used to do that for 13, 14 years. I was the technologist attaching all these wires on your head. And now we've got a device that can be delivered to your home. It can be self-applied, and we have the results within 48 hours. Yeah.
I didn't know that. Okay. So the deep sleep, that's also the slow wave sleep? Okay.
Yeah.
And that happens closer to the beginning of the night, you said, whereas the
Correct.
REM happens closer to the end of your sleeping. Is it affected by the time that you go to sleep? Like, let's say someone's trying to get, they're focused on their 9 hours. Obviously, in a perfect world, they'd be, maybe waking up with the sun or something like that. Is it going to be less effective to go to sleep at 12 and wake up at 9 than it would be to go to bed at 9 and wake up at 5?
That's a good question. There are conflicting studies that say, it's better to get to bed before midnight. The term midnight itself is middle of the night, right?
Yes.
The point that I would prefer to make here, or to kind of drive home, is it doesn't necessarily mean you should be going to bed at 9 o'clock versus 12 o'clock or 1 o'clock. I would say continuity is king here. Keeping the same routine would be more the point that you'd want to kind of drive home. If you're going to bed at 9 o'clock one night, and then you're getting up at maybe 6 o'clock or 5 o'clock in the morning, and then you're going to bed at 11 or 12, and you're getting up at 6 or 7, and it's back and forth, back and forth. Our bodies crave routine, just like when we're kids. There's that. You do your bedtime bath, you do your story, and your mom or dad kisses you on the head goodnight, and you say your prayers or whatever your routine is. It's very formulaic, right? Our kids crave that. But as we get older, it's the same thing. Our bodies want a wind down routine. So one of the most paramount guiding principles within sleep hygiene best practices, and sleep hygiene is, again, the things you can do throughout the course of the daytime that put you in the best position to sleep well at night, is going to bed at the same time and getting up at the same time, keeping those bookends on, and be diligent with those hours. You can let it waver 10, 15 minutes, but I would say, 11 to 7, let's say, and just keep that if that's the world you can operate in. Now, not everybody can get 7 or 8, 9 hours. So if you can only get 6, that's when we want to kind of shift away from the quantity and really look, is the quality of the sleep that you're getting, is that 6 hours rich in nature? Is it giving you those symptomatic improvements? You might not be able to get the quantity, but is the quality of your sleep really effective? And again, the home sleep test we do, we have a sleep stability index. We have a sleep quality index that we measure, so we can make sure, at least if you're only getting 6 hours, at least the quality and the nature of that sleep, that you are hitting all of those different stages.
Okay. And, most people know what it feels like not to get good sleep. You feel like crap the next day. You're exhausted. You're yawning all day. What are the red flags that you would say people should look out for when what would you say should push someone to get a sleep test?
So I would say this. If you've implemented, the best sleep practices like we talked about, and if people do a Google search or ChatGPT or whatever search engine they're using, sleep hygiene techniques, again, there's probably 20. Everything from going to bed at the same time, getting up at the same time, watching caffeine intake, alcohol intake, all that kind of stuff. If you put everything and you focused all of your efforts into, your sleep and making it a priority, and you're still waking up feeling unrefreshed, if you're still groggy, if it takes you, a couple hours to get, that hamster on the wheel from you're just not firing.
Yeah.
If you're finding that, you're having to take naps in the afternoon just to get through your day, that would probably be an indication that something should be investigated. There can be a lot of different markers. It looks at sleep apnea. We'll touch on that quickly. Sleep apnea is really the most prevalent sleep disorder that we have today.
Yeah.
And what that is pauses in your breathing while you're sleeping at night. I go to the gym. I work out 3 or 4 times a week to maintain this completely average looking body. But I go through there and I see people all the time where, their goal is clearly weight loss.
Yeah.
And they're probably doing the best they possibly can to achieve that by dieting, exercising, but they likely have sleep apnea. Now, what sleep apnea does is it's pauses in your breathing that occur, a few times an hour or many times on an hourly basis. I have patients that stop breathing over 100 times an hour.
Oh my God.
Their upper airway closes. They have a massive oxygen desaturation. And because of those respiratory events are occurring on such a high frequency, they're not able to get to those restorative stages of sleep. So they're spending 7, 8, 9 hours in bed, but maybe they're only getting 5% of their deep sleep, maybe 5% of their REM sleep, and they're sitting in those light stages. And therefore, they wake up and they don't have the energy levels to be successful in the gym.
Yeah.
So how do you expect somebody to, be successful in these other areas when their sleep is so unbelievably broken it's the foundation on which, nutrition and exercise will sit.
Yep.
And it's one of those things, it's like a root cause analysis. We have to kind of get to this first. And I've seen it happen time and time again. We've identified somebody who stops breathing 50, 60, 100 times an hour. You implement a therapeutic option, let's say CPAP. Now what happens is they're able to get to those restorative stages of sleep. They're able to start off their day with 100% battery power. Here's a good analogy they like to use. When you go to bed at night and you plug your phone in, you wake up in the morning, it's got 100% battery power, right? You can do 100 different tasks on it, order a pizza, check your socials, you take a phone call, God forbid you actually use it for a phone these days, and you plug it back in and boom, the next day you got 100%.
Yeah.
When people go to sleep at night who have severe sleep apnea, because of all those respiratory events that are occurring, even though they've been in bed 8 or 9 hours, when they wake up in the morning, it's like their internal battery maybe only got to 50%. And so now by 1, 2 o'clock, 3 o'clock in the afternoon, they're exhausted.
Yeah.
They just don't have the energy levels to get to the gym. It's like, I got to go to the gym now at 4 or 5 o'clock. They can't do it.
No.
And so they fall off. The retention isn't there for the companies like Freeform Fitness. You see people fall by the wayside. They're just not successful.
Yeah.
So, identifying the importance of sleep and, maybe ruling out those sleep disorders. I know this is a bit of a long-winded answer, but
No, it's good.
this is, there's over 100 different types of sleep disorders. And, if you're constantly groggy, if you're constantly unfocused, if you just can't seem to, put together a solid day where you're optimal from your mental health, are you reactive with your emotional health, stress and anxiety? All of those things come down to that foundation, which is sleep.
Yeah, so true. And the quality of your sleep is also going to affect, your appetite, the foods that you reach for, your hunger levels, your satiety levels, your energy in the gym, like you said. So you're not going to be able to push as hard. And then if you do push hard, it's going to be really hard to recover from that. It's going to take longer. You're going to be sore for longer. So it's going to slow everything down. That's not to say that you can't see results with sleep issues, but it's going to make it so much harder, so much more unpleasant. That sort of leads into my next question kind of perfectly, actually. What would you say to people who do have sleep issues? Because I know that there is some sort of varying advice where some people say, if you have sleep issues, if you have a poor sleep at night, go exercise first thing in the morning. Mm-hmm. It'll sort of set your energy for the day. And then hopefully it'll help you to wind down later in the day. Would you advise to keep the intensity low, scale the intensity, stop arduous exercise altogether? Like how, what's the research like with respect to different types of intensity for exercise when you're having sleep issues?
I would say, you'd want to adjust accordingly and make incremental changes, perhaps, probably first thing in the morning or, before lunch, as opposed to later in the day.
Yeah.
A lot of studies show that you should not be exercising 2 hours before bedtime because it's going to take a long time for you to come back down, your heart rate, everything else. So I would say, if you're struggling with sleep, you have to kind of acknowledge it first and see if there's any further investigation that needs to be happening. But I would suggest, for your training purposes, try to get that done before noon if you can. Get it done first thing in the morning because it's going to do a lot of things for your overall mental health as well.
Yeah.
If you get it, I find if I can exercise first thing in the morning, my clarity is there, my cognition levels are up, I'm able to perform better at work.
Yeah.
It kind of gets rid of, the fog, if you will. But for the timing, I would also say whatever you can keep to as well is a big piece as well. So just like our sleep routines when we go to bed at the same time getting up, I think people will be a lot more successful if they can build it into a routine that they can continue and maintain. Would be a bigger piece here. And if they're struggling, I would remove the napping piece altogether. Really? People might go and do their workout and feel like I have to have a nap in the afternoon, but if that's impacting your sleep quality at night, one of the first things people will say is if you have any issues falling asleep and or staying asleep, and you're napping throughout the daytime, wax that out immediately. Get that out of there. There's no substitute. You can't be like, I'll get a couple hours in this afternoon or half an hour, 45 minutes here. The data is pretty strong on that where you should be removing any sort of napping. Now, if it's a nap for performance, let's say, because I've worked with several sports organizations, and their physical output is a lot more where they actually look at sleep extension periods, right? So it's not just getting to 7 to 9, like when I'm working with Ottawa Senators and things like that, you talk about maybe getting 9 to 11 hours worth of sleep because their physical output throughout the course of the day is much more aggressive than what the average guy like me is, for instance. And For the intensity levels, I would say, to circle back around again, probably the AM hours would be what would be better to exercise. And if you're struggling with your sleep, you don't want to force yourself into a position where you're going to cause injury. I would definitely look at the foundation first. Like anything else, a solid foundation allows you to build stronger bricks above it.
Yep.
So I would look at that first before you overdo it. If you're going for, personal records, PRs with weight lifting and things like that, maybe take it easy. And if you're struggling with your sleep and you just don't have those energy levels, you don't want to overdo it and cause a strain or an injury. Maybe look to a cardio workout, like a nice brisk walk. I would say for everybody, to improve the quality of your sleep, one of the things you can do is get that step count up. We talk about 10,000 steps a day. Get that up to 15,000 if you can. Get a good hour, an hour and a half if you can, of just cardio.
Yeah.
Now, it doesn't have to be running. I'm not saying become a long distance runner,
Yeah.
because that can do damage to your knees and your joints, especially based on your age and things like that. But
Yeah.
the cardio piece is fantastic. And so many studies now show the more exercise you do, the deeper stages, that deep slow wave sleep you get into, because your body's in that physical repair mode where that growth hormone is being released and that muscle and tissue regeneration is taking place. And you're less likely to arouse from that stage of sleep because it is the deepest form. You're out, you're under. And so those two kind of play off each other.
How about for people who are, tired during the day, but wired at night? Because some of those people, they're exhausted all day, then they get to bed and suddenly they can't relax. They're waking up all throughout the night. They're tossing and turning. And maybe they are exercising and they feel like they're still not getting the rest. And the more they exercise, the worse it gets. So where would you say those people fit into? What's going on there?
Again, could be a variety of different reasons. We call that like the racing mind, if you will, right? People have a really hard time detaching. I'm myself like that sometimes as well. We just did an article for the National Post last week where they interviewed us about getting tech out of the bedroom and that kind of stuff.
Yeah.
That's a really big culprit. But, for those people that have those active minds in the evening, there are some tips and tricks, unwinding techniques that you could potentially do. So we could even say that right out the gate. Get the technology out of the bedroom. You shouldn't have your phone in the room. There's alerts. You're going to be kind of, engaging with things. Maybe there's stressful emails that are coming out. There's things that just don't need to be responded to. But ultimately, what we would suggest in this particular situation is there's a technique for several techniques you can use. There's one called the 4-7-8 method, which is essentially like based on yoga practices and mindfulness and deep breathing. So it's like breathe in for 4 seconds, hold for 7, and exhale for 8. The whole kind of concept here is to just kind of lower that heart rate and focus on your breathing meditation. What I like to use, and I've had success with some of the patients that we've helped out, is take yourself on like a mental walk. And the level of detail has to be right up there. So I'll give you an example. Like I'll be lying in bed and I'll say, okay, I'm going to go for my mental walk and I'm going to go for a walk around my neighborhood. I'm going to go to the front door. I'm going to just choose to wear my Nike running shoes as opposed to my Adidas because they're more comfortable. I'm going to put on my left foot first, my right foot. I'm going to tie it up. I'm going to unlock the door. I'm going to walk outside. I'm going to notice that my neighbor's car is missing. It's not there. I'm going to walk to the end of the block. I'm going to notice that they just painted the fire hydrant. It's a new color. That level of detail as you're going through the mental walk will allow you to kind of detach yourself from all of the other things that might be racing through your mind, your deadlines that you have to meet, financial obligations. Maybe there's some family stressors that you're going through. And take yourself on that mental walk through your neighborhood. It allows you to detach yourself from all of those thoughts. And by the time you get, to a block or two down your street, if you're engaging in that level of detail as you walk through, or another one would be do a round of golf in your head, 18 holes of golf. And kind of really focus on all of those different things. Again, what you're doing is you're separating yourself. You're taking yourself away from that racing mind would be a good one. Another one we suggest as well is if you're one of those people that's like, oh, tomorrow I have to remember to do this and I have to remember to do that. And, I have to pick up the kids from basketball practice and I got to remember to get milk because we're out of milk and I've got to make sure to send that email off. What we suggest doing is actually having a little notepad, a little journal by the side of the bed.
Yeah. Not the
So write that down, like make a quick little to-do list as opposed to having that ruminate in your mind where you just can't switch it off. You're like, man, how am I going to capture all of these things tomorrow? Have a little notepad, jot all the things down, put it aside, and it's done.
Yeah.
So there's tips and tricks for a variety of different people. But again, it's maybe looking at what you're doing throughout the daytime, for instance. Your caffeine intake, your alcohol intake, all of these things have a pretty damaging effect on our sleep as well.
Right. So why don't we sort of move through those a little bit? You mentioned the phone, especially late at night. Why don't we talk about light environments and the risk that scrolling on your phone at night can pose, and even scrolling on your phone or screens during the day. And then let's unpack exposure to sunlight and stuff like that.
Yeah, let's start off with the sunlight. So we'll start from the morning, the moment your feet hit the floor in the morning until bedtime, kind of walk you through the day. So the sooner you can expose yourself to as much daylight as you possibly can, the better. First thing in the morning. Crack those blinds open. Don't reach for your phone first thing. I know a lot of people do that, and I'm guilty of that as well. This is like best practices, right?
Yeah.
We have to operate with
I think that's also
whisper.
putting the phone outside of the bedroom and bringing back alarm clocks.
Yeah. Yeah, that's true. We don't even have those anymore.
No, it's true.
And you don't have to reset your alarm at the time shift change now, but everybody's got, maybe put the phone, and we actually talked about this in the National Post article. If you're going to have the phone in the room, maybe keep it on the other side of the room, plugged in on your chest of drawers or whatever, so your feet have to physically hit the floor to go and get it.
Yeah.
But we'll say, exposing yourself to as much daylight as you can first thing in the morning. Daylight enters the eye via the retina, and it actually activates and interacts with our suprachiasmatic nucleus, otherwise known as our SCN, which governs our body's internal circadian rhythms, and it's called the mother clock, if you will. It's our sleep-wake cycle. So that exposure to light actually causes ebbs and flows with hormones. It suppresses melatonin, and it starts the activation of adenosine, which is like a sleep pressure that builds up. So with that exposure to light, it actually activates a variety of different systems, digestive systems, hormones that are kind of starting to flow, and it kind of wakes the body up.
Okay.
So, get outside. If you can go outside for that, we talked about getting the 10,000 steps in. Get outside, expose yourself to as much daylight first thing in the morning would be fantastic for your overall sleep-wake cycle and that circadian rhythm, which is, when we feel tired in the evening and, how we feel throughout the course of the daytime. Throughout the course of the day, I wouldn't say that there's any real need to detach yourself from your electronics. We live in a world where you're either on your phone or you're on a laptop. We've got screens all around us right now. I would say, try and live a balanced life with your electronics. In the evening time, that's where we'd probably want to start putting in some best practices here. So just like the exercise, you don't want to eat too close to bedtime, work out too close to bedtime with that 2-hour window, and eating 2 hours before, and your screen time, we'd say. So the general rule of thumb here, give yourself a 2-hour window, whether it's exercise, food intake, and your electronic devices. There are some studies that are kind of being debunked a little bit now about how screen time suppresses melatonin. There is a correlation between blue light and the suppression of melatonin. Melatonin is our sleep-inducing hormone, which allows us to feel tired. That's produced intrinsically. We people do take over-the-counter melatonin, which isn't great. But the blue light suppresses melatonin. But more so now, we're kind of moving away from that kind of data that's not as conclusive as it once was, let's say 5 years ago. It's the fact that you're constantly engaging with a device that's, again, causing potential stress and anxiety. Maybe you're watching your TikTok reels and things like that. And, depending on what you follow, Trump said something else that's going to set you off. And now you're, in a situation of where your heart rate's getting elevated, your blood pressure's getting elevated. I think the main message here would be to be, kind of go old school if you can, unwind with a book. Have a nice bath, listen to a podcast. You want to make sure that the temperature of your bedroom is very cool as well.
Yeah.
A lot of people don't realize that because, if you sleep with a partner, some people likes to be really warm and cozy all under the blankets, and the other person runs, hot. So they don't want that. So, your bedroom temperature should be somewhere between 65 to 68 degrees. Our body's core temperature needs to drop a degree or two in order to be able to achieve optimal sleep, that internal temperature. So yeah, from a screen perspective and a light exposure, again, as much daylight as you can first thing in the morning, expose yourself to that natural light, no sunglasses, no hat, out, let that vitamin D soak in.
Yeah.
And that's a challenge right now, right? You come home, it's 4:30, 5 o'clock, and it's dark already.
Yeah.
People have seasonal affective disorder where they're not getting as much sunlight as they can, and that vitamin D isn't being soaked in, and it's a challenge. And again, we're kind of giving people guidelines here. You got to kind of operate within what's possible.
And I think part of it is it's hard to create habits where they feel inconvenient, especially during the Canadian winter. Like first thing in the morning, like I do not want to get up and put on boots just to get some sunlight, right? But it's about that habit stacking, right? If
Yeah.
you wanted to get your steps in, maybe you do it first thing in the morning. Or, maybe if you don't want to go outside, you just give yourself a break and look out the window for 5 minutes or open the window, So it's like trying to find the spots that are realistic for you, where you don't feel like there's this huge emotional burden on you to get another thing done. Because for so many people, pushing the needle towards better habits and better health is actually about removing habits that might be not serving you instead of, trying to stack on a bunch and try to be this perfect, biohacker. It's interesting that you talked about the melatonin thing. Can you touch on that a little bit more?
Sure.
In terms of supplementing, I mean.
Yeah. So it's right there over the counter, and it's easy to grab. Anybody, I have people, that give it to their kids because they haven't put in the best sleep practices, which is not advised whatsoever. Melatonin from an exogenous form, like over the counter, you really want to be careful with the dosage. Minimal dosage, I would say, just a couple milligrams kind of thing, like maybe 1 or 2, nothing over 5. I think some of the main doses come like sometimes 5, people are taking 10. What ends up happening is, just like anything else, your body builds up a tolerance towards it. Melatonin will get you to the stop line, but it won't win the race for you. It's not going to give you better quality sleep overall throughout the course of the night. It may help induce it. And a lot of studies have shown that it's not even that effective with your sleep onset latency. It'll reduce it, maybe 5-10 minutes or something like that. But inevitably, if you're taking it on a nightly basis, you're just going to be looking to increase that dosage. And it should be used as a stopgap measure. It should be used episodically. It should be used for, maybe if you're jumping in and out of time zones, on a vacation, for instance. If you're going through a life stressor with, a loss of a job or a family member, and you want to use it, over the period of a couple of weeks or something like that, then that's fine. But again, a very low dose. And you don't want to have it extend. I've had some patients like, I've been taking melatonin for like the last 2 years.
Yeah.
And it doesn't seem to work for me anymore. Well, obviously, you can't be taking a whole bottle to knock yourself out.
Your body gets used to it.
Yeah, there's been some reports. It started off in the States as well, but those CBC reported on this recently, I think in this last year, maybe 2025, where the dosage amounts within the bottles were actually incredibly varied, which is scary.
Oh, yeah, that goes for all supplements. They're so hard to say whether the dosage amounts are accurate, especially if they're not being third-party tested.
Yeah, and I think with melatonin, it's listed as like a dietary supplement, and it's actually doesn't go through the same checks and balances to make sure that the dosage amount in each pill is exactly the same as it says on the bottle. And people have been giving these to their kids, and I think some of it was like, in some cases it was 400% what the actual dosage is on the bottle.
No.
So it put kids in emergency rooms. So, I would be very careful with melatonin. I would look at everything else first before you start looking to have something that's an aid, any type of sleep aid. And without fail, you should be consulting your family physician before you start implementing anything, any sort of medication, whether it be over the counter or prescribed medication as well.
Yeah.
Because, these could be interacting with other things that you're taking. But I would go back to like a grassroots approach where let's invest, let's do everything we possibly can to achieve quality sleep, optimize it, best practices. And then again, if you're going to use melatonin, the main point here should be the lowest dose you possibly can. I would say nothing more than maybe 2 milligrams or something like that.
Yeah.
And just for a very brief period of time, nothing longer than a week or two.
Yeah.
Because again, it's as I mentioned, it'll get you that starting line of the race, but it's for your overall sleep quality, it's not going to do any better for you.
Yeah, sort of like majoring in the minors kind of thing. It's like move the big rocks first.
Good analogy. Yeah.
I think a lot of what you talked about before in terms of, core temperature, breath work, avoiding exercise, avoiding eating towards the end of the night, they all sort of have this common denominator, which is reducing your resting heart rate or bringing down your heart rate, getting into a state of calm before bed. Is that accurate to say? Is that all of the ways that we would want to go about it? for people who are struggling with racing heart rate, what are places that we're looking for to clean up, if that's a problem area?
Yeah, well, I mean, it depends on that particular patient, but yeah, that routine is kind of like your standard approach to have like a calming, wind down routine, maybe that takes an hour. I would switch off all the lights in your house or dim them all, kind of thing. From a racing heart perspective, I don't know, there might be something else you want to look at there as well. We talked about this at the beginning. There's over 100 different types of sleep disorders now. Like, we get referrals from the longevity clinic, so give them a shout out as well, Dr. Benashemi.
Yeah.
We get referrals from a variety of different clinics and cardiologists where, maybe there's a new diagnosis of high blood pressure, elevated heart rate, maybe there's atrial fibrillation going on. And a lot of times it can be a sleep disorder that's the culprit there. Mm-hmm. So, if you have accelerated heart rates and things like that, I would definitely be looking to some cardiology, a cardiac workup kind of thing where they can probably do a deep dive for you. But, if you've given yourself that 2-hour window with regards to exercise, food, and let's say electronics, you should be able to, with the best practices in place, be able to fall asleep within 5 to 15 minutes seems to be the average time.
Right.
A lot of people have no problem falling asleep.
It's staying asleep.
It's staying asleep, exactly. And, a lot of people wake up at like 3 o'clock in the morning, 2:30, 3 o'clock in the morning, and there's a variety of different reasons that could be. One of the reasons is, I mentioned at the beginning, you've spent the first half of the night in that deep sleep, that slow wave sleep for that physical restoration. Mm-hmm. So let's say you've gone to bed at 11 o'clock. Now it's 3 o'clock in the morning. You've already spent 4 hours sleeping. So you've cleared out a lot of that adenosine, which is that sleep pressure that builds up. You've had access to a lot of slow wave sleep, which is the deepest form that's kept you under. But also at 3 o'clock in the morning, your cortisol levels start to activate. There's melatonin starts to decrease, cortisol starts to activate. And now you're spending the back half, let's say that 3 to 7 window, that last 4 hours, in some of the lighter stages. Also, maybe you're going into your REM sleep. And depending on what you're dreaming about, that can cause arousals. It can cause you, multiple awakenings kind of thing. So
that's an indication that the cortisol is rising too early.
Could be.
Compared to a normal wake time.
Mm-hmm. I think generally speaking, it's usually between that 3 to 4 o'clock when you'll start to see things start to shift from like that sweet slumber that you're in at the beginning of the night to where, the morning time, your body's slowly starting to wake up. Certain systems are starting to activate. You can kind of look at it from two different perspectives here, where if you're not getting the quality sleep throughout the course of the night, and there's multiple awakenings throughout the course of the night, if it's taking you too long to fall asleep, if you're waking up 6, 7, 8, 9 times, that's when I would probably say it's probably time to get a sleep test done.
Yeah,
they're so easily accessible now. Like, if you still like the idea of going to the hospital is the gold standard still. They're looking at 100 different types of sleep disorders, but from a home sleep test that we do, we can really provide a lot of insights.
Yeah.
Where the device is shipped to your home, we have the results within 48 hours.
Yeah.
And then we're digging in on that post-test analysis with the patient. We do a sleep optimization program with them where we actually go through the report one-on-one. And this is all done through sleepefficiency.ca. If I want to give myself a quick plug there.
Yeah, plug yourself. So there's like the lifestyle and sleep optimization side of it, where you're sort of trying to go through all the habits, be like, okay, like what time are you waking up? Are you waking up at the same time every day? Are you going to bed at the same time every day? What are your eating habits, caffeine habits, exercise habits, whatnot? When are you going to turn towards something more clinical where you're like, let's say someone has sleep apnea, just for simplicity's sake, what's the standard of care there in your opinion beyond the sleep optimization stuff? Is it just CPAP? Are you pushing someone towards, myofunctional therapy, asking them to see their dentist? Like, where should people go? Because there's so many options, and obviously it depends on the person.
Yeah.
But what are the flags that you're raising?
So let's talk about the symptoms that would maybe drive somebody to get a sleep test done first for apnea.
Yeah.
First one, there's a bunch. Let's say morning headaches would be an indicator, because those oxygen levels that are potentially dropping. Excessive daytime sleepiness, chronic snoring. Snoring can be benign. It can be just irritating to somebody who's like suffering the blast radius of that particular snore, but it also can be, that chronic snoring can be indications that there's upper airway resistance and there's potentially blocks that are occurring. Waking up gasping for air, of course, waking up with a racing heart rate. If you're waking up and that heart rate is accelerated, it's likely due to the fact that you've had a pause or a reduction in airflow that's caused that strain on the cardiovascular system. So yeah, multiple awakenings through the course of the night. Poor memory and concentration would be another one. So let's say you've gone to your doctor and you're like, yeah, I'm waking up. You've ticked 3 or 4 out of these boxes, and you get a sleep test done. So sleep apnea is broken down into mild, moderate, and severe, and it's based on how many respiratory events you have on an hourly basis. It's called an apnea-hypopnea index. And depending on how many events you have, it puts you in a mild, moderate, or severe bucket. Anything between 5 to 15 events per hour is deemed mild. Anything between 15 to 30 events per hour, you're deemed moderate. And then anything over 30 events, you're severe. But again, I've had patients that stop breathing over 100 times an hour. So anything over 30 is severe, but there's a lot of room in the end zone there for those severe apneics. So depending on what those results of our test show, and we do have a respirologist, a board-certified sleep physician who reviews all the results. It's not just myself as a technologist reviewing the data. One of the best respirologists in the city. Based on those results, the recommendations would be built into the report. So some people do move forward with a CPAP machine. CPAP stands for continuous positive airway pressure. It's a mask that goes over your nose and or your mouth, and it acts as a pneumatic splint for the upper airway. It keeps that upper airway open. It removes the respiratory vents. It keeps your oxygen levels up above 90% where they should be. Not a cure, but a treatment. Incredibly effective. 50% compliance rate long term, not the best compliance rate. And a lot of people have a hard time adapting to wearing it because it's a mask on your face. It's not the sexiest thing in the bedroom.
No.
It's invasive, and if you're worried about your partner, but at the end of the day, incredibly effective. So sometimes that's a recommendation, and people will move forward after taking a test and they'll get on a CPAP, and it can be a game changer for them, especially for those severe apneics. Those that are severe respond to the therapy a lot faster and are much more appreciative of it because they've been craving that good night's sleep for so long. For the mild and the moderate apneics, we do often, our respirologist will recommend what they call a mandibular advancement, where they'll be referred to a sleep apnea dentist. So, it wouldn't be a mouth guard that you would buy off of Shoppers Home Health or Amazon, or, you've Google search mouth guard or something like that. Now Shaquille O'Neal's trying to push you every time you open up one of your social medias. Shaquille's a massive sleep advocate, but the oral appliances are custom made by a sleep apnea dentist, a board-certified sleep apnea dentist, and essentially the mandibular advancement, kind of like a bite guard, but it's not for teeth clenching. That's bruxism, which is clenching. This kind of adjusts your jaw, and through incremental millimeter adjustments can actually treat the sleep disorder breathing as well.
Right, and I'm just going to touch on that really quickly, just because if the mandible, he's talking about the mandibular splint, starts to fly back, because you can't keep the jaw forward, it's going to close off the airway. So what that splint is going to do is it's going to support the jaw and the bite, so it's not flying back and just closing that off, which makes snoring and just dysfunctional breathing more prevalent.
Absolutely, yeah. The third piece we can touch quickly. So we've done CPAP, we've done the oral appliance.
Yep.
Unfortunately, there's not a lot of options, right? So it's kind of like A, B, or C kind of thing. The last piece is positional therapy. So I'd say more than half of the people we see come through, 55%, they're all positional in nature, which means most of the action that's happening, most of the sleep disorder breathing that's happening is happening when they're on their back. When they're on their side, they're fine.
Yes.
Just like you get the elbow from maybe a significant other, your partner saying, roll over. The snoring, that's because there's more weight on the upper airway when you're on your back. Gravity kind of kicks in. And some people stop breathing 27, 28, 29 times per hour when they're on their back, but on their side, they're only 2 or 3. So they do what they call enforced side sleeping or positional therapy. And what that is there's different companies. It's $1 billion industry now.
Wow.
Back in the day, it would be a tennis ball in the back of the t-shirt, sewn in so you can't roll onto your back. Now you've got companies that offer anti-snore t-shirts that are picture inflatable inserts that go into the back of Velcro pouches that prevent you from rolling over. There's bumper belts that you can wear.
Oh my goodness.
There's like shoulder harnesses that you can wear that prevent you from rolling over. They all have the same concept. And the efficacy here is just stay off of your back. If you can stay off your back, some people will go to a pillow wedge, right?
Yeah.
Not just regular pillows, but like a pregnancy pillow, for instance, that's maybe 35, 40 pounds in weight, and it's a long brick of a thing.
Right.
And that's going to position themselves to be on the left side or the right side. So, there's some lifestyle changes you can make. Obviously, weight loss would be a good one if you can reduce that weight, specifically where you carry your weight. As I mentioned before, I work out 3 or 4 times a week. I have apnea myself. I stop breathing 26, 27 times an hour. I'm a high end of moderate because I don't have that like Brad Pitt jawline. My neck circumference is elevated. I'm 6'1". I'm 48 years of age. I weigh about 186, 187 pounds. But any extra weight goes to my jowls. It's like a Holmes family trait that I cannot escape. You know, my wife says it all the time. She's like, "You're fit, but like any extra weight, it goes to your face."
Okay.
And that causes the occlusion. That causes the weight on the upper airway.
Yeah.
So I've actually moved to a CPAP. So not only am I, a sleep consultant, I run a company, I work in the hospital system for years. I'm an end user of CPAP as well.
Yeah.
And it's been a game changer. I love it.
Yeah.
Even on boys' weekends where I'll go away to Toronto and I've got a whole hotel room to myself where I wouldn't actually need to wear it, I wear it without question.
Yeah, for sure. Because that's your clarity. That's your peace of mind.
Yeah. I'm relying on it.
It's really interesting that you brought up the positional thing, because that is something that can be helped with exercise and mobility and movement therapy as well, which is because if your body is sort of rigid and bracing during the night, it's an indication that your rib cage isn't able to expand in all directions. So you're sort of stuck in this one position, and you have limited options for breathing during the night. So giving your rib cage, your body, your muscles the ability to expand and stretch in different directions is going to give you more movement options in general in the gym, but also more sleeping options, so you can have that flexibility. And your body's not braced and stuck in these positions, especially for people with neck, jaw, shoulder tension. You wake up and you've been clenching all night, or your body has been braced and stuck in this position because it doesn't have another option to move. So you can obviously get the positional therapy, which is a super great option for people who need that knowledge for where they should be sleeping through the night. But the long-term fix is always going to be sleep optimization patterns and fixing your lifestyle and habits during the day, and then also being able to move your body so it can have options for breathing, because that is going to be one of the biggest rocks when it comes to sleep disordered breathing. That is fixing and helping your breathing during the day too, because if you're not breathing well during the day, you're certainly not breathing well when you're unconscious at night.
A lot of people have limitations with the body positions that they can sleep in due to injuries, right?
Yeah.
It's like, oh, well, you want me to stay on my left side or my right side? Well, I've got a knee replacement, or, I've got a hip dislocation.
Yeah.
I've got old soccer injury that's plaguing me. So it's not always possible to be able to commit to a specific position based on, wear and tear on the body over the years.
Exactly. Yeah.
So the mandibular advancements are a great opportunity for people to use something other than a CPAP. They are quite expensive though. The mandibular advancements.
Yeah.
I think you're looking like $4,000 to $5,000. Mm-hmm. But I also believe that, there's a good portion covered under a general dental plan there as well. So at the end of the day, not to sound too cliche, but can you put a price on your sleep, right? That's the worst thing to say right now.
Well, yeah.
From a cheesy kind of like catchphrase, but like it is truly the foundation that's going to allow you to achieve success in all these other areas. And if we don't prioritize it and at least give it what it's looking for, it's not going to, your return on your investment in the daytime, whether it's in the gym, whether it's in your private life, whether, as a parent, as a professional, as a partner, all of those things are going to suffer unless you give the acknowledgement to the sleep and what it's trying to do for you.
And I think a lot of people don't realize what they're missing until they have that experience. But what was your experience of life before and after the CPAP, and what are other successful stories or turnarounds that you've seen in your practice? Yeah,
personally, again, as I mentioned, I wouldn't go without it now. I've found a massive difference in my mental clarity, my emotional regulation. Again, I have 2 teenage boys that drive me up the wall. So I'm maybe less reactive in those spaces, just because, you're getting to that REM sleep now that affords those recoveries in an emotional response. I catch people on a weekly basis who have never would have gone to a sleep test in a hospital because, they're like, oh, I would never be able to sleep there. So why should I even bother getting tested? Mm-hmm. People stop breathing 70, 80, 100 times an hour. We catch them regularly. And with the implementation of a therapeutic device, whether it's CPAP, it's been a game changer for them. It's not only it's increased their longevity. We've potentially avoided a massive asteroid like a heart attack or a stroke. Keep in mind, when people have these pauses in their breathing that last 60 seconds, even 90 seconds, their oxygen levels plummet. And when their oxygen levels are going down below 80, below 70, into the 60s, it's like their heart is running a marathon every single night when it should be resting and recovering. Their heart's actually working harder and faster when it's sleeping than it is in kind of a rested state.
Yeah.
And I catch people, again, weekly. We do a high volume of patients now where, they may not have made it to, the hospital-based sleep test that's in a year and a half. No, some of them are so severe. And not to say that they would maybe pass away, but we've avoided or reduced dramatically the impact of a cardiovascular event. Again, untreated severe sleep apnea increases the risk of heart attack, stroke, and congestive heart failure.
Yeah.
You got these people that are approaching their senior years and they've given 40 years to their work, and they're in their 60s now, and the worst thing that could possibly happen is all of a sudden for you to take a massive knock where now it's reduced your physical capacity, your mental capacity, your ability to go and travel now because you've had a huge stroke where you're now having to do rehab. I love what I do. I feel like we're doing phenomenal work by, identifying all these people because the prevalence is massive. And some people may not even know that they're suffering from these sleep disorders, and specifically apnea, because that's just been their baseline for so long. They don't realize how poor quality sleep there is because for the last 10 or 15 years, it's been so incremental, the deterioration of their sleep, that they feel that that's just the way they're
Sort of
supposed to be.
accepted as normal. Yeah, it's true.
I've had patients come back and they're like, when I worked in the sleep lab, even at the Queen's Carleton Hospital, I would slap a mask on somebody and put them to bed. And, maybe prior to on their first test, they stopped breathing 100 times an hour. And now I've splinted that upper airway through that positive airway pressure. And they come out, even after sleeping in a hospital bed all night with a mask on for the first time, they said, what the hell just happened? I have not slept like that, like almost in tears, putting their arms around me because it's that noticeable on the first night.
Yeah. Yeah. And, it changes your baseline levels of stress, right? So that your ability to be resilient is that much lower. So, these are people who are like, oh my God, like, where am I going to cut out the stress in my life? It's not like I can, not have my family anymore. It's not like I can quit my job. It's not like I can stop exercising. Like, there are non-negotiables on the table where it feels like I have nowhere else to pull from in my life. And that's an indication that you need to look at your sleep because your baseline resilience is not even there. Because people are looking for any option to feel stronger, more clear. And, usually they're going to think it's in some sort of pill form, but sleep is the number one place to look. And again, like, spend tons of money on a bunch of different interventions, or just bite the bullet and fix your sleep, or at least look into your options for fixing your sleep.
We can rule something in or out. Again, circling back to our home-based sleep tests, we have devices that have shipped as far as Nunavut to Iqaluit. We have lots here in Ottawa. We go right across the province, right across the country. Within 48 hours of you completing the test, you've got the results back in your inbox, signed off by a respirologist with clear recommendations, and then that post-test analysis with us where we can dig in together. And it may not be massive sweeping changes, but like you said earlier, just start stacking a couple easy wins that allow you to, move forward with being better versions of yourself in every sort of capacity, just by ensuring and making sure that and protecting that sleep in the nighttime. Because that, if I have that cup of coffee at 4:00 in the afternoon because I needed to get through, well, 50% of that caffeine is still going to be in your system at 10 o'clock or 9 or 10 o'clock that night. And then at 2 o'clock in the morning, you're going to still have 25% of that caffeine rattling around your system.
Yeah.
It's all these, I don't want to use the word hacks, but it's all these best practices and fine tunings that we can make. And it's not like removing a non-negotiable. It's just saying, I'm not going to have any coffee after 2 o'clock in the afternoon now because I know that's going to impact my sleep quality that night.
Yeah.
Same thing with alcohol. They've talked about the nightcap. And of course, everybody, or not everybody, but lots of people enjoy that glass of wine before bed to unwind. It allows them to
helps them to relax, but then their sleep quality is worse, right?
You got it. It's a sedative, but ultimately it metabolizes into a sugar, and it's going to cause arousals. It's going to cause sleep fragmentation, and it also suppresses our REM sleep. Alcohol robs you of that REM sleep. Instead of having those REM cycles at maybe 20%, even after maybe only 2 or 3 drinks, that REM sleep could be reduced dramatically to maybe only 10%. And then you don't have that cognitive horsepower the next day to go out and battle as well as you possibly could.
Yeah. I'm curious to hear what you think about the supplement side of things. I know sort of like, I think, whatever someone needs. If someone tries a supplement and it really makes a big difference for helping them to relax, I think that that's a great thing. But again, the root cause intervention, I think, is always going to be superior. It's also interesting to think about how, taking something like a magnesium or something can help calm someone down and lower resting heart rate, improve relaxation. But at the same time, if your body is aroused, you're going to be burning through electrolytes or any of those things that are naturally occurring in your body that would support better sleep. So in my mind, the best route to go is to just sort of tackle the root cause and, use those supplements as a crutch or a support in the time that you're trying to rehab that. Would that be your same take, or what's your take on certain supplements?
Yeah, I would actually ask you to educate me a little bit on the supplement because I don't know a lot about supplements outside of my scope. I know the ones that are, great for sleep, obviously, and you touched on, magnesium glycinate specifically, calms the central nervous system, allows you to kind of drift into a better sleep. You should probably take maybe a couple hours before bed, not right before, obviously, just so it can kind of metabolize. But yeah, I would actually defer to you. You tell me, I don't look, in our world, we say there's no supplement for a quality night's sleep, right? There's no substitute for a natural sleep.
Yeah.
And everything you put in your body is going to have some sort of effect. So our main gospel our main message is keep your sleep as natural as possible. Do not try and add anything that's going to potentially, in theory, maybe improve it or take away from it because it could be interacting with other medications that you're taking. Again, as a sleep technologist, I stick to what I know. I operate within my world, which is, diagnostic testing. But yeah, I would love to hear what what people you've been working with that have utilized.
There's some people who see great results from magnesium glycinate or bisglycinate. It helps to relax their nervous system. L-theanine is another popular one. GABA is another popular one. Some people use more natural ones like valerian root or, chamomile tea, things like that. But anything really that's going to relax you and warm you, help you feel relaxed. We talked about baths. I think for a lot of people, it's a very ritualistic thing. And then, it sort of brings them into that state of mind that relaxes them. But really, it was just those main three ones, the GABA, the L-theanine, and the magnesium that I've heard.
How many of your clients are using? Is it a high population that are looking for aids?
People are always asking about supplements. Like people are constantly saying, oh, what should I take? But it's mostly protein and stuff like that. I think the main problem for most people is their ability to relax and wind down at night. And I think a lot of that stuff can be cleared up with the lifestyle stuff. So I don't know. I was really just curious to see if you felt like there was any tried and true that you felt was good. But
we don't really touch that space because we're pure diagnostics.
Yeah.
And then the therapeutic approach, we kind of operate in those two worlds. But I know the supplement piece is massive now. Like you can't, you're constantly being suggested the latest thing kind of thing. And again,
it is a money grab for sure. But like at the same time, it does help some people. So.
For sure. I think it's great for, like, I take magnesium myself.
Yeah.
I'll take my omega-3s in the morning. I take my vitamin D. There's certain ones that I'll take just so, general kind of health and wellness, But yeah, again, the main message, I guess, is that from where I sit on this side of the table is, to just try to keep it as natural as you possibly can.
Yeah, I would agree. And I think the only thing that I would suggest that people should look into is probably the magnesium piece of it, because something like 60 to 80% of people are deficient, especially in North America. So it is, one thing that could, sort of check a box that could sort of bring you to that relaxation towards the end of the night. But again, I'm always going to be on the side of things of like lifestyle and breathing therapy, because that's my niche, that's my bias. But at the same time, if you're breathing slower, if you're able to regulate a lower respiration rate and a lower resting heart rate, then your sleep quality is going to improve. So and you're going to burn through magnesium at a lower rate. So it's sort of like a circuitous route. But if you are deficient, first of all, you should try to find that out through blood work. But it's likely that you would see benefits from a magnesium supplement.
A lot of studies show now as well, getting back to, the amount of sleep that you're getting in that sleep deprivation, where we talk about your leptin levels and your ghrelin levels as well, right? Your hunger hormones, essentially. So, people that are constantly they're carrying a sleep debt, maybe they're only getting 5 or 6 hours. It's going to really impact the leptin, which is, when you feel full, and the ghrelin, when your hunger hormone, essentially.
Yeah.
And, it's 11 o'clock at night, and now you're reaching for the cupboard because you're looking for an external fuel source, because those hormones are being dysregulated, unregulated, and they're out of sync.
Definitely.
Because of the sleep deprivation as well. Not really along the line with supplements, but if we're talking about like health and wellness and the food kind of component, people who are sleep deprived are consuming an extra 500 to 750 calories a day just by going for those extra cookies in the cupboard at the end of the night kind of thing.
Right, because your body's not getting quality sleep and energy from that sleep, so it's looking for...
Exactly. And maybe you should be going to bed at that time, as opposed to like putting on another episode on Netflix and getting half a bag of chips or something like that.
Yeah, and I think it's so hard to know too, especially now with like, people have no idea what to eat, when to eat. There's so much disordered eating out there. People are very confused about, whether to trust their appetite, whether to override that appetite. And again, it's always going to go back to, maybe you wouldn't have that problem or be asking those questions if you really dialed in on fixing your sleep.
I think it's multifaceted.
For sure.
Agreed.
Right?
Yeah.
Agreed.
Like the sleep is great. Make sure you eat healthy and, get your exercise in. It's all like that: nutrition, exercise, and sleep are those 3 pillars kind of thing. And I think if you acknowledge them and focus, and we're start of January here, 2026, we're crazy busy this time of the year. Just like I'm sure the gyms are, right? You go and it's like, everybody's like, this is the year I'm going to get healthy. This is the year I'm going to make a whole bunch of lifestyle changes. And that's great.
Yeah.
And you may fall off, but the fact that they're stepping up and trying to take another swing,
For sure. And I think like any good decision begets more good decisions. So I think, you got to just start somewhere. If that means you're starting with your diet, if that means you're starting with your sleep, if that means you're starting with your exercise, then perfect. But I think always just like going back to, am I recovering from what I'm doing through the day? And is what I'm doing through the day supporting my ability to recover?
Well said.
Right?
Well said, yeah.
Yeah.
Should we leave it there?
Yeah. I feel like
great.
that was good. I feel like we got through everything. Thank you so much for coming on. How do people find you? How do people work with you?
Yeah.
Yeah.
Thank you for bringing me in. It was great. I love I could talk about sleep for hours. So sleepefficiency.ca is our website. Everything is really on the website there. If people want to request a sleep test, they can do it through the website. We don't need a referral to proceed, so people can self-refer. We can have the devices are flying out our door on a daily basis. They're showing up. If we live in that Amazon world now, where if my mouthwash doesn't show up within 24 hours, I'm angry.
Yeah.
We've got these devices where they're arriving at the patient's door. They do the test in the comfort of their own bed, and within 48 hours, we've got the results back. So, by this time next week, we could be actually talking about the results and making those lifestyle changes to optimize your sleep. And again, they're all reviewed by a respirologist. So, we're located here in Ottawa, but I don't know how far this reach goes. We ship them right across the province, right across the country.
Okay.
So, sleepefficiency.ca.
Awesome. Sleepefficiency.ca. Thank you so much, Andrew, for joining me today. Thank you so much for listening, guys, and have a good day.